are psychological disorders, and where do different fields of psychology believe that psychological disorders come from? Today we're going to introduce an overview of psychological disorders and how the perspectives define the disorders. There are a lot of different psychological perspectives we've learned over the course of this whole year, from the behaviorist perspective, psychodynamic, humanist, cognitive, and neurobiological. And each field has their own take on where psychological disorders come from. So let's start by taking a look at what a psychological disorder is and how we get a diagnosis for them. Because a big question that comes up in psychology is, when should behavior or mental processes be considered disordered or warranting a diagnosis? There's a shortcut that's often used in the field of psychology known as the 3 Ds of psychological disorders. The first one being dysfunction, meaning that when we notice a change in someone's behavior or mental process, is it something that is disrupting their daily living? Is it getting in the way of them doing the things that they want to do or should be able to do? The second is distress, which means, does this change in behavior or mental process cause unpleasant feelings for the individual? Are they distressed that they're having these thoughts or that they are behaving in a certain way? And the third is deviation, meaning, has the behavior or has the mental process changed from societal norms? Is it different than what we would expect to see? Now, it's important to note when we talk about deviation as one of the 3 Ds of psychological disorders, that cultural and societal norms are shared expectations and rules of different behaviors and thought processes that guide individuals within a specific culture or society. So what we consider to be normal or abnormal in some way can vary from person to person and culture to culture. And issues such as stigma, racism, sexism, ageism, and discrimination are all concerns within the field of clinical psychology as a result. But if we do notice that this criteria of the 3 Ds is being met, then we might see a specific diagnosis come into play. There are 2 major organizations that are responsible in helping create a diagnosis for different psychological disorders. The first one being from the APA, the American Psychiatric Association, and their publication called the DSM-5. Currently in its 5th edition, it is the Diagnostic Manual for Psychological Disorders. It lists all of the various disorders that are recognized and the symptoms and prevalence that we see in these disorders. It's important to note it does not talk about causes of disorders or treatments, because that will vary from individual to individual. The other organization that we can also look to is the World Health Organization and their International Classification of Disorders. It's another system for classifying and identifying different psychological disorders as well. We'll get into those specific disorders and those symptoms a little bit later, but for now we want to take a look at how different perspectives explain the nature of psychological disorders, because each perspective is going to have their own take on what the cause of different disorders are and why we start to see them develop. For example, in the behavioral perspective, we're going to see that emphasis on observable behavior. So less on the mental processes, but more on what do we physically see and how that behavior might be learned through interactions with the environment, focusing on those principles of conditioning and reinforcement that we learned back in the learning and behaviorism unit. And so their look is going to focus on maladaptive behaviors, those maladaptive learned associations that are going to lead to dysfunctional patterns of behavior that have been acquired through experience that contribute to psychological disorders. And that is, of course, going to then lead to how they specifically go to treat those disorders, which we'll see in a little while. The psychodynamic perspective is going to focus on explaining the cause of psychological disorders from unconscious processes and early childhood experiences. That is what determines our personality, and things like unresolved conflicts and defense mechanisms can lead to the development of the different psychological disorders as well. The humanist perspective, of course, emphasizes personal growth and self-actualization, and so their focus is going to be on how people fulfill their potential, or lack thereof in the case of a psychological disorder. The cognitive perspective is going to focus on thoughts and beliefs, so the way that we think about ourselves and how that is going to then affect our actions and our behaviors that follow. If our thinking process is logical, our behavior is often going to be what's considered normal as well. However, if our thought process is illogical in some way, that can affect our emotions, the way that we feel about ourselves, and it's going to affect our behavior as we interact with our environment. The evolutionary perspective is going to focus on how human behavior and mental processes help contribute to our survival. And they're going to focus more on the adaptive behaviors as opposed to the maladaptive behaviors. So we'll see a little bit less of explaining psychological disorders from the evolutionary perspective, at least when it comes to the different treatment options that we have available. The sociocultural perspective is going to focus on, of course, society and culture, how different environmental factors have a direct or indirect influence on our behavior and mental processes by looking at things like cultural norms, values, and socialization. And then, of course, the biological perspective is going to focus on biological processes, things happening inside of our body with genes, neurotransmitters, brain structure, and hormones, and how those changes can have an impact on our behavior and mental processes as well. The popular approach to explaining psychological disorders from these different perspectives is often the biopsychosocial model, also known as the eclectic approach in psychology, because it's typically not going to be just one of these different areas that is the cause of the different disorders that we see. The biopsychosocial approach takes a more holistic approach, looking at, of course, the internal processes of someone's biology, but also the psychological or cognitive factors, as well as the environmental factors that can all play a role in the development of different psychological disorders. And so we'll see in treatment that although there are some specific therapy techniques dedicated to each perspective or field, oftentimes what we'll see in psychology is using different techniques from different approaches in order to customize treatment to the individual and their needs and circumstances. And with that biopsychosocial model, in looking at both the biology and the environmental factors that can influence the development of a psychological disorder, one of the very popular theories about disorders is called the diathesis stress model, which essentially says that we need both the genetic predisposition and the environmental stressors that can cause the precipitation of a psychological disorder to manifest or show up in an individual. It's the idea that those two together kind of create a perfect cocktail scenario that allows a psychological disorder to develop, which might explain why we might see it show up in one person and not necessarily in someone else. Because if someone has the genetic predisposition, but they don't have those environmental stressors, we might not see the development of that disorder. Whereas someone else might have some environmental stressors, but not the genetic predisposition, and so we won't see a disorder develop in them either. But that same type of environmental stressor combined with someone with the genetic predisposition, that's where we'll start to see those different disorder symptoms manifest. And so it's important to keep in mind that, of course, all individuals are different, and even knowing the symptoms of different disorders to make a diagnosis, it's going to look slightly different in different people. And treatment won't be a one-size-fits-all option either. But hopefully, with a better understanding of the symptoms of various disorders, individuals can get the best treatment possible and will hopefully start to feel better sooner. So we'll take a look at all of the different disorders next, and then we'll move into treatment. Thank you so much for watching, and as always, remember, be kind to your mind.